The response to the refugee crisis unfolding along Ukraine's 2,000-kilometre border to the west has been remarkable. I was moved by the scenes at Poland's border when I crossed it there, with people rushing with clothes, with food, with offers of homes and jobs. Individuals, professional groups and entrepreneurs have been joining charities, local councils, national governments to meet the needs of what is estimated to be more than 1 million people who've crossed the border so far. Now, each country, each border crossing is, of course, different. Our correspondent Nick Thorpe has lived in Budapest more than half his life and has been on the border between those two countries for 7 days. He's about to be joined by an old friend.
All sorts of equipment, from freezer to examination bed to chairs and electrocardiograms and blood sugar measures and all the equipment that a medical professional can need.
This is András. He's my family doctor in Budapest, 3 hours drive away. We normally meet in more mundane situations, like needing a quick PCR or antigen test. But I first got to know him during the last refugee crisis in Hungary in 2015, when he set up a mobile clinic. He's doing the same again now.
We have been there in 2015 crisis. It was a different time and the different people were coming from different locations, but they had the same problem. And we are facing the same situation and we try to be there.
And where are you going to set up?
We try to stay mobile. Our foundation, the name is Medicine on the Spot.
You're mainly family doctors?
Family doctors and emergency doctors and also psychiatrists.
People are putting a brave face on this after quite harrowing journeys across Ukraine to get here, and often they're quite traumatized, including the children, but no one until now really has had time to deal with that.
I think what's important, not to hide any information from these children. So we have to be honest with these children and we have to ask what kind of questions they have, and we have to answer all the questions honestly. That's very important because we are not able to prevent the trauma, but it's worsening if they don't really understand what's going on.
So András, the clinic's up and running now, and you've already had your first patients.
Yeah, we have already 3 patients, and most of them has high blood pressure, headache, and painful legs. And also, what we have seen, a person who suffers from a psychiatric problem, and he lived in a facility for, I think, like 20 years in the same place, and it was destroyed by the Russian army, and he had to leave alone, and he doesn't know what to do alone. And he just showed in his camera, in his telephone, the burning facility where he lived.
How did he get right the way across Ukraine in wartime when he's been in care most of his life?
He followed the crowd, and that's all. Just follow the crowd. He wants to be alone because he's afraid that other people will be frightened because of his problem.
And he shouts sometimes at them.
It's called Tourette syndrome. Like shouting, he doesn't have control on his voice and on his movements sometimes. And it seems like he's trying to attack or trying to shout, so he seems dangerous, but he's completely harmless, not dangerous at all.
András, you've only been here a few hours now. You don't know how long you're going to be here. How are you preparing yourself psychologically for the next weeks?
For me, this is the thing I can do to go here and help as a medical professional. And this is how I gain some kind of control of this kind of situations, because otherwise I would sit and just get frustrated. So for me, this is the way to treat anxiety, I think.
So at least you can do something to help, and that keeps you sane.
Yeah, that's true.